My name is Jan Smith. I'm a social worker by training, but by love and passion, I'm a musician. I started playing piano when I was 4, and I have played for other people to perform ever since, and have been playing for the local high school choir director since my daughter was in 6th grade. And I love it. I love it. A lot of the letters that came in with this nomination came from those high school kids. And so when I was diagnosed with breast cancer and they told me that I probably would not be able to play the piano, that was a devastating blow for me. In June of 2006, they diagnosed a lump in my left breast. And my general surgeon at that point said that he thought I was a good candidate for conservation surgery. So we did that, and I basically got a clean bill of health in August of 2007. We took a trip at that point to celebrate all of this being done. And while we were on the trip, I realized that the whole area around where we had done the surgery was starting to get hard. And so I went back to the surgeon and he said, it is cancer. So I went back to my oncologist, and it got to the point where we were able to think about doing the surgery. But at that point, the general surgeon said he felt that his part of this surgery was the easy part, that all he had to do was remove the breast and remove as much cancer as he could remove, but that it was the technician, the plastic surgeon, who needed to understand me as a patient, understand my body composition, understand what's going to look right and what isn't, and it was the plastic surgeon who was going to have to make the difference in the surgery. Well, that's when I went to see Dr. Karp, my plastic surgeon. If I had to describe him in one word, I would just say hopeful. And he said, I don't see any reason why you can't continue to play the piano. We'll just have to make sure that that happens. And so we had the surgery in September of 2008. They biopsied the other breast just to make sure and discovered that it was there as well. But it hasn't stopped me. I've been able to keep playing. This is not a death sentence. It's a life sentence, and you can make a choice. You live with cancer or you die from it. And I choose to live with it.
In 2003, when the American army came to Iraq, I met soldiers in the street, American soldiers, and I started talking with them. They told me that I know little English, so maybe if I want to help them. I said, yes, I want to help you. So I started working with the American army like translator. So one day when I came to the work, the terrorists, the people who was, working with Saddam, they stopped me, and one of them, he has gun and he shoot me. But I put my arm like this, to cover my face, like, because just like that, and he shot me, and the bullet go inside my arm and then go in my face. My face is like destroyed. When they send me to Kuwait, they start with me with the plastic surgery. And there is one Kuwaiti doctor. She has American lady. She has foundation. And she told me that if she came here at this time, I will told her about your story, and maybe she will help you to go to America to make the surgery. Elisa Montenti, she came to Kuwait. When she heard about me, about my story, and when she saw my face, my arm, she was very sad, She became very sad, and she decided to help me as she can. Then when I came here to America, Global Medical Review Fund, they helped me. And because of Dr. Aliza Dekave, it's like normal. And it's something like impossible. He take a bone from here because I lost the bone. He take it from my leg and he put it here. And then the nose also, he take a skin from my forehead and he built the nose. It's really something amazing. So I decided to help Elisa and her foundation. So sometimes when she brought Iraqi kids from Iraq, they need somebody to translate them. So I go with them sometimes to Shriners Hospital in Philadelphia. So this is what can I help Elisa with. I like to do it.
The battle that I've had with basal cell carcinoma began in my 30s. The first one I had was on my face. The second one I had was on my ankle and was when I was 64 years old. And the little one that I had on my nose, I thought it was completely excised until a little later last year when it got larger, and went back to the doctor, and he immediately sent me for having a Mohs operation with Dr. Cowan. The cancer was so bad that on the day of surgery, I started about 8 o'clock in the morning and I finished about 6 or 7 at night, which meant, of course, that there wasn't much left of the nose when they got finished. I thought this was going to be a sizable problem and I would need to go to a plastic surgeon immediately. The forehead flap result has been very beneficial. The beauty of it is that nobody knows that I have a different nose. Apparently my nose resembles the one I had before to such an extent that people don't know I have a new one. But I proudly tell them that I have a new nose. It's important for me to help other people because I feel that I am blessed in so many ways. And first of all, of choosing a profession, a medical profession, which is a natural thing to help other people. I work with the Shore Regional Breast Center doing an outreach program that is trying to get women to get mammograms every year for early detection of breast cancer. I work also getting them into a program which provides for free screening and then actually taking care of that cancer. So it's a matter of giving back from my very own experiences. I would like to thank, foremost, my friends and family who are so supportive of me, and my patients, as I've said. But I'd like especially to thank Dr. Khalife so that I could get time to tell people how much I appreciate my plastic surgery.
Growing up with a port wine birthmark, just a pink mark from my right temple all the way to my upper lip, it wasn't as much I had to get used to it, but it was more the constant having to answer the questions about what was wrong with me and what was on my face. My first plastic surgery for my birthmark was when I was 4 years old. I learned that you can have up to 7 to 8 surgeries, and I've had 8. My last surgery was when I was 16, and even though my birthmark is still there, at least it's a lot lighter, and I'm grateful for laser surgery to even do that. Being in college, a sophomore, and also I've competed in beauty pageants all the time, I'm asked, do you believe in plastic surgery? And my first answer is absolutely, because it's not about changing completely how I look. It's actually having people look at me rather than a blemish or a birthmark or anything different. I was always worried the first thing that people saw was my birthmark, and what I realized is through plastic surgery I could finally know that people were seeing me for me. I decided to write my book when I was 16. It's about Lucy the hippo with a pineapple birthmark, and she has to help her class learn sensitivity by overcoming her own acceptance of her difference. And so when she overcomes her fear, she actually helps give others a voice and learn how to really be a team. And so I think that that's always what I believe in, is that everyone can contribute. I wouldn't have been able to achieve my project if I hadn't had the support and the funding from others. And that's when I wanted to further my contribution by starting the Open My Eyes Foundation. It helps really support those grassroots efforts that lack the funding that they need. What I would want to leave with people from just my experience every time I go into a classroom, every time that I want to tell about my book and my experience, is not just, oh, I have a birthmark and I've learned from it, but really that, oh, I had something that I thought was a weakness and that really just helped me reach more people. That we all have limitations. And I think accepting both strengths and weaknesses and really wanting to be your whole self is what I always want to encourage people. That's why I focus so much on my character and being sensitive to others, because it's just affected me so much.